We are excited for you to join us. I am your host. My name is Kulsum, and I represent VMet College and the Innovation Navigator program that we are leading. This morning's session is specifically for the dental care sector. You have joined us for a free CPD workshop designed for individuals responsible for managing compliance within the dental practice. This session is being delivered by Dental Compliance Made Easy, and in our workshop, we've got Veena, Helen, and Rosie, and they are the team that's representing the company. They will be leading the workshop. But before we start, I'd like to introduce the Innovation Navigator program, and then I will hand it over to our experts. So our Innovation Navigator program is a business support program led by Birmingham Metropolitan College. It is designed to help businesses stay ahead of the curve in times of digital disruption. Just like in the dental sector, you've seen a shift from manual processes to digitalization. New technology and equipment is being installed in practices and dental labs to improve business operations. So this is where we play a role, and we support businesses in their journey towards digital transformation. So apart from this, we also, as part of the program, we are also offering services in areas of AI, cybersecurity, and social media for your practice. If you want to avail any of the other services, then please do reach out to us. We will be sharing details later. A little bit more about our program. I shall be playing a video now, and it will tell you a bit more about our program. So please give me a thumbs up if you can hear the video, okay? Thanks. Right. Thank you for watching. I would like to emphasize here that our college, it leads on in the dental sector skills training. So as part of the support that we are offering under the Innovation Navigator program, you can access hands-on training at our facilities. We have new state-of-the-art facilities, and you can get in touch with us, and if you want to avail this, you will be able to train your staff using our CAD and CAM new technology suite that we've just renovated and set up. So please do get in touch to avail all the free benefits of the free support. You can do scan the QR code, and I will put in a registration form in the chat if you want to just register your interest there. Moving forward, today's session is on CQC compliance success, and please participate by commenting or asking questions in the chat or in the question and answer box. We have our expert facilitators here today who will help you achieve your CQC success. And before I hand over, I would just like to launch a quick poll to get some feedback from our audience. So please do answer the question in the poll, and then we will begin the session. Okay. Right. Over to you now.
Thank you. So Veena, if you could share the presentation, please, that would be great. Thank you so much for joining today. It's lovely to be able to have the opportunity to talk to you about what we do, how we can help practices. And the aim of today really is to kind of give you a bit of an insight into compliance, into digital compliance in particular, and how this can help practices. I don't know whether, I don't know how you're managing compliance. If you could maybe pop in the chat how you're currently managing compliance. Be interesting to see whether you have a software solution like ourselves, or whether you are doing it paper-based. I mean, I'm sure it won't surprise Helen, because Helen is our compliance manager and is talking to practices on a daily basis. She also has worked and potentially still continues the odd bit here and there to kind of help out in practice by doing the compliance for the practice. So I don't think it will come as a surprise to her, but it definitely did to me when I first found out that so many people are still doing compliance paper-based. So I don't know if yours, yes, so you see, I probably think you're probably doing the same thing. So you're logging some things online, but you're mostly probably doing things in policies and procedures on paper, storing them away in kind of staff files. So we'll be talking a little bit about that and how a compliance portal like ourselves could really help you. So today's event, we'll go through the intro to the DCME team. So Dental Compliance Made Easier, we abbreviate to DCME, just so that you know what we're talking about throughout the presentation. Our team and who we are, what we do. As I've mentioned, why digital compliance is important for a dental practice to manage and maintain compliance. Veena will kindly be going through a demonstration of our online compliance portal. So you'll be able to see how the system works. Feel free to pop any messages, any questions in the chat box there, and we will definitely be able to answer those ones at the end for you. And common CQC inspection failures and how to avoid them. Was saying before this meeting, actually, I think that's probably the million-dollar question in compliance. Something that people always ask, why do people fail inspections? How do I avoid that? And then we'll be doing the Q&A session. We will be focusing primarily today on CQC. However, we do also help with HIS, HIW, and RQIA as well. So different regions there. So who we are, we're an online compliance provider. We have an online compliance portal, which offers CPD courses as well and HR support, as well as support from our dedicated compliance team, Helen and her team. They're always on hand to help and support practices, and that's all included within our membership. From the very start of the business, when our CEO and founder kind of founded this business, he's always put the members at the heart of everything that we do. Everything is digital, but you really have that hands-on approach whenever you need any help and support. The main goal, obviously, is to remain fully compliant and pass those all-important CQC inspections. When you get that dreaded call to say you are going to be inspected, you want to know everything's in order, and that's how we help. We currently have over 2,600 dental practices using our membership to our compliance portal, which we're really proud of. So this is around 30,000 users on the compliance platform. Something to also mention is that our team, our majority of our compliance team have come from practice, from Bupa potentially as well. They have written compliance policies throughout their whole career. They know exactly how to do this, and they're experts in the field. Also, having had that expertise and that kind of experience in practice, it really helps for us to develop our portal in a way that is user-friendly for the practice. We know how complicated it is to manage compliance within practice, how complicated that can be, and we really try to simplify that in the best way possible. Our inspection pass rate is 100% for engaged users, which we're really proud of. Providing you follow everything on the portal and you follow the help and support that we give you, the end goal really is to get that call whenever for the inspection and be ready and prepared. Another thing that we also help with is CQC registration applications. We've got a fantastic registration team who will help if you are looking to buy an existing practice or if you're looking to set up a squat as well. So do bear us in mind for that. So we also have a short video to show you.
We are Dental Compliance Made Easier. Our ultimate goal is to take the worry, anxiety and the burden out of your compliance and inspection. Dental Compliance Made Easier is a CQC compliance service that helps dental practices pass their inspection smoothly and stress-free. You will have a friendly and experienced team looking after you, our dedicated dental experts and dental professionals.
We really enjoy working with Dental Compliance Made Easier, being very supportive and helpful during the process, helping us to put all our policies in place.
They're responsive, are friendly, they're helpful, and if we were to have an inspection, I know that they would make sure that we were in a good place.
We understand the pressures and the frustrations you face in running your dental practice efficiently, whilst ensuring your records and documentations are up to date and easy to access. Our user-friendly digital platform is trusted by thousands of practices across the UK. It is fully cloud-based, so no more bulky files and paperwork. Our practices say again and again how happy they are with the digital compliance portal and our dedicated and professional support from the team.
Portal's great. It's great for us and for the staff. They find it really easy to use. It's colourful, it's inviting, and it's very organised.
I find that the portal is really easy to navigate around. The search bar is really useful, so you can get directly to whatever you need.
My entire team using it daily to ensure that they're ticking off all their daily tasks. We actually use their portal as a team calendar as well.
We make your staff's lives easier and free up their time so they can focus on what really matters: patient care and giving your patients a fantastic service. Our compliance platform includes dashboards that give you key metrics to ensure your practice remains compliant. We have a compliance calendar which tracks key tasks that are due, so all your compliance activities can be monitored and managed. Online staff CPD is also available, and the system will even alert your staff of when their CPD is due. We are confident you will love our compliance portal and our personal service. If you are a dental practice that wants to be compliant and well-led, then please contact our friendly team today to book your trial.
Thank you, Veena. So yeah, we will share that video with you as well after the meeting today, and we will also share the slides in case you you wanted those as well. So who are Dental Compliance Made Easier? You know what we do now, hopefully from that video and the description there. But this is Rajiv Lakhani, our CEO and founder. Now, Rajiv started the business as a consultant with a folder-based system for practices in 2018. So at this stage, from what I understand, I wasn't in the business at this stage, but he was physically creating these folders with paper. So all of the policies and all of the documents that they needed, he was creating these files and then personally taking them out to practices, showing them how to use this, and kind of teaching them and training them on an ongoing basis of how to remain compliant. So obviously a fantastic start, but like anything, needed to go digital, needed to be simplified and needed to be able to get out to more people. So in 2019, DCME went digital, and we've grown massively through that. We're also in the process of developing an app as well to even simplify this even further, really. It's recently seen as partner with Agilio, so I'm sure a lot of you have already heard of Agilio in the dental industry. This allows us to further benefit our members with additional products and support as well. Now, our team, this is just a snapshot, this slide and the next one, of our teams. We've got a fantastic registration team. We've got an amazing compliance team. HR and support are fantastic. Our portal, yes, it is amazing. The digital side of things is so important for practice. But I think one of the best things about DCME is the fantastic team and support that you have in place to help and support you whenever you need it as a practice. Okay. As I say, just a snapshot of the team. I think we've got about 35 team members now and growing. So yeah, we're helping and supporting those practices whenever they need that. So the benefits of having a digital compliance system, as I say, shocks me that so many people still do it paper-based. There's a really simplified way of doing that by using an online compliance portal. Some practices just don't know that this is available, but I think once you see this, you will understand how much easier it could be, how much more time you could save as well. So it eliminates the need for obviously paper for bulky files, although that's where DCME started. That's not kind of the way of the future now. It makes things a lot more easy. It minimizes the printing costs. It makes keeping on top of day-to-day compliance tasks easier. As the video briefly mentioned, and Veena will go into a bit more detail, it's based effectively around a kind of diary calendar system. So it will notify people when tasks are due, which will really help to keep on top of everything, make sure that you don't miss anything. So much goes on in a dental practice. There's so much to consider in terms of compliance and everything else, just the day-to-day running. Any way that we can simplify that, we do. That's something we really pride ourselves on. It will also save your time on compliance. It doesn't need to be a time-consuming, laborious task to go through the folder and paper-based system. By simplifying it, putting it all online, it can really save you time. I also, under the understanding and the feedback that I've had, I'm sure Helen could maybe comment on this, it makes the CQC inspection so much easier and so much quicker with everything being online and in one place. I think that's feedback that you guys have a lot, isn't it, Helen?
Yeah, and I've sort of experienced it firsthand. When you're used to having things in folders, as you know, that's how everybody started. When you got the call from the CQC, you'd literally have to get out 15 different folders, and then they'd ask you a question and you'd have to leaf through each one to find the relevant document that you're looking for. Now, because you've just got a login, you can log them into the portal almost and just say, here you go. A lot of the inspectors are familiar with the portal now, so they know where to look. And so it just makes everything so much quicker. And we've had a lot of practices in the last sort of 12, 18 months who have said the CQC have been in and out within 2.5 hours. Previous to that, they could be there the whole day. It still does happen in certain circumstances. You know, if it's a massive practice or there are major issues, they are in longer. But we are finding more and more now that they're trying to get in and out as quickly as possible. As long as you can show them what they need to see, they'll look at it and off they go.
The end goal. Thank you.
Get them out as quick as possible.
Yeah, that I can imagine. I've not been in that situation, but I can imagine it's a really nerve-wracking one. So one that you want to get over and done with as soon as possible. Thank you, Helen. So accessing the compliance system from anywhere is a really big thing as well. So if you're a practice manager, practice owner, or you manage compliance or are in charge of compliance, it's really handy to be able to access this from outside of the practice. You can make sure that when you're, if you want to, obviously enjoy your leave. I'm not saying you should be doing this on your annual leave, but if you want to ensure that you are checking in and that you're making sure everything is being done, you can do that remotely just from logging into the portal to make sure those tasks are completed.
I will jump in there, Rosie, actually.
Yeah.
I did hear last year there was a practice that I supported, and they were a very small practice. They didn't have an office or anything like that. It was literally a reception area, one surgery, and that was it. And so when the CQC went in, they went in and did all of the physical stuff they needed to see, spoke to all the staff members, and then they went next door to a coffee shop. And they were able then to go through the portal and all the documentation with the practice manager there, where they actually had somewhere they could sit down together and go through it and discuss it. So it has those kind of benefits as well.
That's brilliant. Yeah, thank you, Helen. Yeah, that's a massive benefit, isn't it? If you don't have that facility, just caters really, I suppose, for every size of practice as well. Delegating tasks to staff members. Now, you don't need to manage compliance on your own. I know there's a lot of jobs that you would have to do as a kind of practice manager, practice owner, or head of compliance or lead compliance in a practice. But you can delegate a lot of tasks to staff members and then ensure that they are keeping on top of those. That in itself takes a lot of the workload and the strain away from somebody managing compliance. And obviously the fact that it's secure and it's risk-free. So it's all in one place. It's in a secure system. Everybody has logins, but you will have, as Veena will explain shortly, you will have two options of login. So there's a management and then a staff login. So there are certain documents that you might want to keep confidential that you can do so. And everybody has their own login to the portal. But again, not having paper that you could potentially lose, files that could be misplaced within practice, everything's just in one place. So now I'm going to pass you over to Veena, who will do the portal demonstration. This will just show you exactly how the portal can help the practice in terms of going digital, and I'll leave you in Veena's hands now.
I am just going to remove my camera just for the demonstration, and then I'll join back after the demonstration has been completed. So yeah, my name is Vina, and my job basically is to do the demonstration and training sessions. Going digital is the way forward. A lot of practices are moving away from manual folders and going digital. And basically with DCME, we have all the mandatory logs and checklists available on the system, most of which are online and can be accessed by all staff and completed electronically. When the information is recorded digitally, it will just enable easy storage of all the evidence, requiring less physical space and saving time and money, like Rosie mentioned earlier. Obviously, printing costs, paper cost, and like I said, finding the space to actually hold those manual folders. It's all electronic. It will all be on the system, just easy to access by any member of staff. Now, every single practice that comes on board with us, we will onboard you and we will train you. And obviously, you've got the support team available to kind of help and support you once you're onboarded as well. As Rosie mentioned, there are two types of users on the system. One is a practice manager. They'll basically get full access to the system where they can oversee all the staff to see how they're getting on with their training, recruitment, reading policies, for example. And then the second level will be a staff member, but staff will only have access to their own information, nobody else's. Now, these three metric boxes, all staff will see on their own kind of logins. But as a practice manager, when you look at these three metric boxes here, this will then show you how your practice is getting on with completing tasks, and also for staff compliance as well. So how well led you are, basically what information you hold for your staff, with regards to their training, their recruitment information, and as I said, reading policies as well. Now, every single staff member will have access to the portal, like I said, depending on obviously who you give access to. And the way they log in is with their email address and a password, which they will create themselves. If you, as a practice manager, were to assign a task to them, they will see that task in their own calendar. And the calendar looks a little bit like this. Okay, so if a task is incomplete, it will be orange, but once it is completed, it will change color to gray. So let's say, for example, today, a staff member wants to complete the medical emergency drugs task. They will get an email notification and they will also see that event in their calendar. What they need to do is they basically click on the event. They can either go directly to the practice logs and checklist folder, which is a digital folder in the compliance suite, or they can go to the online form that we have available to them. So if I go to the online form, what they then need to do is basically go in and use this online form to obviously complete the medical emergency drugs kit. So on this particular log here, this is basically linked to the calendar. So what will happen is they will add the expiry dates into these boxes here. And as the drugs are due to expire, it will change color on here. So they'll know in advance, a month prior, that something is due to expire because it will change color to orange. And when it does completely expire, it will change color to red. They can also add in useful information like comments, maybe batch numbers or notes to show they have reordered something, because if somebody else then logs in, they can actually see that something has been ordered and they don't need to worry about it. Or if something doesn't apply to them, they can also mark that as not applicable as well. Each week when they get the prompt in the calendar to check the emergency drugs, that person will go in and tick to show they are checking it. Obviously, the compliance team have advised that it is best practice to have two people checking it. So those two checkers will add their names in here, and then they will save this document. This information, because it is digital, it will then get stored in the history section at the top. So anyone in the practice can then see what's being logged by the staff members. And then once they have completed this online log, that person, whoever is responsible for the task, they will go back to the calendar to show they've completed the task. So it's just a case of right click and then marking it as complete, and then that color will then change to gray, and then the percentage on the dashboard in the purple metric box will then start to increase, so you can see obviously all tasks are being completed by the practice or by the staff. I think Rosie mentioned this earlier as well. You can also delegate tasks to staff members as well. So you don't want to be taking ownership of all of the events. That's a lot of work for one person to do. So yeah, if you did want to assign a task to a different member of staff, it's just a case of right-clicking on the event and clicking on Edit to change the responsible person from this drop down here to the new responsible person. And you can decide at that point if you just want to give them that task just for the current event, or maybe you're going on holiday and you want to assign it just for a couple of weeks to them, so you can do all future events here as well. Choose how long you want to assign it to them for, and then press the save button. And then once you do assign that task to them, they will see that event in their own calendar. and they will get an email notification for it as well. Practice managers will see everyone's events, so you can keep on top of who's doing what and just making sure that the staff are completing the task as and when they are getting prompted for it. But the staff member will also see it too if it's been assigned to them. Now, the main task will be set up by our onboarding team, so you are just getting reminders for the tasks that are mandatory. However, a practice may want to create additional tasks and assign them to staff members, which is something that they can do as well, just by clicking on the little plus icon here in the bottom right-hand corner, or just by going to the date, right-click, add new event, and then basically just adding the information directly on here. Something else that we do include on the system as well is annual leave. So it's part of the system. So there'll be a third colour in the calendar if it is being used by the practice, where you'll see green for any annual leave. A practice manager will see everyone's annual leave, but staff will only see their own. Moving on to the dashboard again, if I move on to the policies now, this blue box here is an individual percentage. So even though a practice manager sees the purple one and the pink one as practice percentages, the blue will be their own percentage. This will be a good way for a practice manager to be able to go through the policies and go in and obviously mark certain ones as not applicable if it doesn't apply to them, or obviously get the staff to go in and read the policies, because they will have access to these policies on their own login. So what a practice manager can do is obviously no longer need the paper copies any longer. You can do it directly on here because, as I said, all the staff will have access to these policies, and any that don't apply to the practice, they can go in and mark it as not applicable, because what that will then do is when the staff log in, the staff won't need to read it either, because the practice manager has made it not available to them. We will bespoke the policies on the system for you and add in logos and lead names on the system, but that can be amended by the practice manager simply by just going to the practice role section in the menu bar to do that. But the logo will be added here, and then the lead names will be throughout the policy, and also the approved by person will also be included at the end of the policy as well. So if that ever did need updating, that can easily be done by the practice manager just by going to the practice roles section in the menu bar here. So it saves you having to go into each policy. If there was a lead change, safeguarding lead change, for example, you wouldn't then need to go in and basically edit each policy manually. It's just amended in that practice roles section, which will then automatically update it in the policy as well. So each person, as I said, because this is going to be electronic, they don't need to do anything manually. They're going to log in, read the policy on the system by clicking on the policy name here. Once they've read the policy, all they need to do is mark it as reviewed, and that's their digital signature. So what will happen is the blue button will then change to a green button with a date stamp just above it to show that it has been reviewed. Now, another good thing is if there are any kind of regulation changes, then our compliance team will do that hard work for you. They will go in and basically update the policy for you with any regulation changes, legislation changes, and you will get a notification on the dashboard in the latest news section when there is an update, which will then mean that you would go back and read the policy again. So what will happen is automatically the green button will change back to a blue button. The percentage will drop on the dashboard in the blue metric box, and then all staff will need to go back and read that policy as well. There is a way on the system as well, which is quite easy as well, where you can go in and edit the policies yourself if you need to, or create any policies as well if you need to as well. But we'll go through that with you during a training session, obviously, if you did need to know how to do that. Also on the dashboard, you've got this staff compliance section here. So basically, staff will have their own login information, and this will be a good way for you to see how all of your staff are getting on, as I said, with their training information, their recruitment information, and also reading policies. So basically all we do, so as you can see, we've got each staff member and then a percentage here for each person. So basically having a system in place will help the practice manager in managing and supporting staff to complete all the necessary information all in one place, and you can store that evidence electronically. Again, you can come away from those personnel files where you've got contracts in folders and things like that. It will all be recorded on the system. And the good thing about this system is as well that you don't have to do it all for the staff. Staff can log in themselves, and they can also do this themselves as well if they need to. Now, I'm obviously logged in as myself, but if I want to see how Alpa is getting on with reading policies, all I need to do is click on Alpa's percentage here. It will redirect me to Alpa's profile, where I can see what policies she has read by looking at this column here. I can do the same thing for the training information and the recruitment information as well. Or I can just click on Alpa's name, where I'll get an overview of Alpa, where I can again easily see what training Alpa's completed, her recruitment information, if I've assigned any tasks to her, and if she has uploaded any documents. But again, having that information all in one place, if you had an inspection, you don't have to then go through all these different manual files to pull out certain information that CQC asks you to kind of bring to them. It's all on here, all in one place. And I think, as Rosie mentioned earlier, or Helen did as well, CQC can then you can just log in for them. They know exactly where they need to go to find the information that they're looking for, as long as you're utilizing the system, obviously in the best way. So on this system as well, what we do also include is basically CPD courses, which all staff will have access to. These are all GDC verifiable and the standard core courses, which all staff will have access to as long as they have a login. So when they need to take a course, they take the course directly on this system. They would need 80% to pass the course. They would also need to complete a reflection form as well. But once they have passed that course, the system will generate a certificate, which will go here in the CPD certificate section. And it's going to look like this. So what the staff member can then do is view their own certificate, download it, print it off so they've got their own copy if they need that. They can also view their own reflection notes, and they can also generate the certificate. So what each person will need to do is click on the Generate Certificate button, and they will get a prompt to do this, because what this will then do is add their certificate into their own training matrix, which basically where you as a practice manager will then be able to see if there's any gaps in anyone's courses. So if they don't generate the certificate, it won't be attached to their profile. So if it is, then at least then the practice manager can see if there's any gaps in any courses, and if they do need to go back and complete any courses on the system. So if I go to the training matrix now, this is what the training matrix looks like. Actually, before I go on to that, there's a CPD tracker on here as well. So if a staff member takes on any courses on this system, those hours are automatically recorded on the tracker. So again, they can see if they've completed all the hours that they need to do, all the required hours. But if they decide to do any courses elsewhere, maybe they've done some hands-on courses, they can also go in and record those manual hours on here as well. So again, they can see if they do need to cover any other courses, either on this system or elsewhere. This is the training matrix. So we kind of touched on a little bit earlier through the pink box, but the training matrix will be a great way for a staff, practice managers, principals to kind of see if there's any gaps in anyone's training. Each member can manage their own kind of information, and they can basically click on their own name to mark any courses as not applicable. So if they're not kind of clinical, for example, and they're just reception staff, for example, if they don't apply to them, they can go in and mark it as not applicable. If they have completed some courses, already, and those courses are still valid and in date, they can go in and add those dates in these boxes here, because this again is linked to their own calendar on the system, and the calendar will then prompt them when they need to do the course again. On the right hand side is where they would right click and upload their training certificate, and then as you can see here, the folder will then change color to green. When they do take any courses on this system, when they generate the certificate, what the system will automatically do is add the date in the box for them, and it will automatically upload the evidence in the right folder for them as well. So it does become automated, which again makes it easier for them. And again, they'll get prompts and reminders as and when they obviously courses are due to expire. So again, it's good to have all of that on one place as well. But throughout the system, you will notice that we've got like a traffic light color scheme going on. So as a practice manager, if that's a level of access you would have, at a glance, you can see if there's any gaps in anyone's courses, if something is due to expire, maybe they've got some missing information. So obviously what you'd want to see is everything in green, okay, which means that everything is completed. If it's maybe red, then it's obviously expired, or if it's orange, it's only partially completed. So you'll notice this color scheme throughout the system to kind of prompt you visually that something is due to expire, or maybe there's some bits that you need to still collect. Same with the recruitment matrix. Touched on this a little bit earlier as well. Obviously, CQC want to see how well led you are, what information you hold for your staff. Rather than having those manual folders, again, staff can go in and upload that information directly on here. And again, at a glance, a practice manager can then see what information you hold for them. Again, if everything is green, that's brilliant. You've got all the information on here. If it's orange, maybe you're missing a little bit of information. And maybe if it's red, it's either expired or we haven't got that information at all. But again, as I mentioned, staff will have access to the platform so they can all go in, click on their own names. If something doesn't apply to them, they can go in and mark it as not applicable. They can then go in and add the information into these boxes here. And then again, on the right hand side, upload the evidence. So again, it's all in one place, electronic on the system, and you don't have to worry about those manual contracts and, you know, references or whatever else you might need to hold for them. But staff will have access to this so they can upload it on here directly. Moving on to the maintenance matrix, this is a brilliant tool to have in a practice because you're going to have lots of equipment in the practice, lots of registration that you have to go through. So visually, you can see on here whether, again, you've completed registration, maybe there's any service due, maintenance due. So as a practice manager, what you would do on here, say, for example, you need to go through ICO registration, you would click anywhere on this line and you can add in when you last completed the registration. Also add in any notes in here, and then click on this folder here to upload your evidence. So again, it's all in one place, electronic on the system. So you then know when you need to do that ICO registration again, because you will get a prompt via the calendar. So what will happen is when you do save this, initially that box would have been red, but it will then go green like this. And what the system will do in the background for you is it will automatically create an event in the calendar for you to remind you that this task is then due on the 19th of December 2025. 2 months prior to this date, what the system will do is it will change color to amber. And again, you'll get a notification to let you know that actually this is due again. Maybe you can call them in, book it in again. So again, you know it's sorted, one less thing to worry about. But it's the same process again when you complete it again on this date. Pop in the new completed date, pop in the new evidence, save it, and then it just repeats itself. It knows when to remind you because you've popped in the completed date, and it will remind you on the system when you need to complete that action again. The good thing about the maintenance matrix as well, you can customize it. So for example, if some of these things don't apply to you, maybe you've got some extra autoclaves, you can go to configure equipment. And just here on the right hand side is where you go to add autoclave. You give it a name, serial number, save it, add on as many as you want to. And if some of these things don't apply to you that are optional, maybe you don't have a music license, you can remove that from the matrix so it doesn't kind of impact your score. You're only going to get the percentage for all the items that you have got visible on your main matrix page. Compliance audit. This is a brilliant tool that I think Helen kind of briefly mentioned earlier. So this is basically like a little mini mock inspection for you, which a practice can do themselves whenever they want to kind of see how compliant they are before they have an actual inspection. So you don't have to wait for that phone call. You can go on here and do this electronically and then go through the questions, you know, as and when you need to. But to start a compliance audit, all you would need to do is basically go to start a new compliance audit, pop in the date, and then your name against it, and then save it. So normally what happens is when an inspection takes place, the inspection will use a set of key line of inquiries that are directly related to these 5 key questions. Okay, so basically it's like, are services safe? Are they effective? Are they caring? Are they responsive? And are they well led? So we've split this into 5 sections for you. And you can then basically go into this online compliance audit tool and basically carry out your own mock inspection to see how you're getting on yourselves. And again, you're doing this electronically. So electronically, you'll be able to see straight away what percentage you're getting. So all you would do is basically go into each section. What we've done, our compliance team, brilliant compliance team, what they've done is they've put together questions for you that you're likely to get asked. Okay. We've also in the middle part of the screen showed you where to find the information or what you need to have in place to show you're compliant. So I'm just waiting for it to load up. It will come up in a second, but there'll be a section in there where you've got the key questions, then where to find the information, and then all you would need to do is simply run through the questions and answer the questions honestly and say whether you're doing those things, whether it's yes, no, or not applicable. So basically like this. Here's a question. Here's where to find the information. Go through the questions, say yes, no, not applicable, make any comments as you go along, save as you go along. As I mentioned earlier, obviously the purpose of this is being honest about what you're actually doing. If you're not doing something, you're going to say no, because what the system will then do, if there are any areas that you've said no to the question, it's going to create an action plan for you, which you then got guidance as to what areas you need to improve on to bring those scores up. Once you've worked through those actions, you just go back to the same set of questions, change your responses from no's to yeses, again, save as you go along, and then you will start to notice that your score will increase for each one of those key line of inquiries, which will then mean that your overall compliance score will increase too, and you know you've covered everything you need to before that inspection. So as long as you're utilizing the system to its full potential, obviously you're going to know that you're going to pass with flying colors, and this is why we have 100% pass rate. All of our practices do use this option, so that obviously they know how they are getting on before that inspection. As Helen mentioned earlier, I think what CQC is kind of doing is they're doing DMA audits, which is basically known as a direct monitoring approach audit. So this is a virtual audit. So when they can't come out to see you, they'll arrange a virtual call with you instead via Zoom or Teams. And they're going to ask you some questions, not as many questions as they would if they were to obviously visit you personally. But this one here will give you an example of what kind of questions you could potentially get asked. And again, in the same way as a compliance audit, you would go in and answer those questions by saying yes, no, not applicable. And again, you'll get an action plan to work through. So again, you know what areas you need to improve on to get that score up. And then the other audit on here as well is basically the IPC audit, which is basically the infection prevention control audit. We all know this is mandatory. It's due once every 6 months. There will be a prompt in the calendar if you were to use DCME to remind you when this needs to be done. But again, this one works the same way. So rather than doing this manually or directly on the website, we've built it into the DCME portal where, again, you can go on here and answer those questions directly by going to these different areas and doing it directly on here. So they're the 3 different audits. But again, it's a really useful tool doing it digitally on here because, and again, it's all in one place. And if CQC were to log in, they can then see how you're getting on, as a practice. And then we've got the compliance suite now, which is where you're going to find the 16 digital folders that all staff will have access to. So rather than having the manual folders, it's all digital on here, all in one place. Now, another thing that we kind of include for our practices is general HR support and advice. So that's in a restricted padlock folder here, which only a practice manager will have access to. But you'll find things like contracts in here, interview questions, induction forms, basically useful information to help you kind of recruit staff members because we've got all that information in here. But again, if there was something that you were unsure about or maybe you wanted something checked over, you could reach out to our HR team and they'll help and support you with that. If you're raising any complaints, there's a folder here for complaints and significant events, which again is also restricted. It has got a padlock on it. Let me just come out of that one and go to the complaints and significant events. So a lot of you might be doing the complaints manually in a logbook. On here, you wouldn't need to do that because what we've got on here is a digital version of the complaints log. It's an online version. So what that would mean is a practice manager can go in, or the compliance lead can go in, use the online version and record the complaint directly on here just by filling out all these different fields. You can also upload any attachments about the complaint, say whether it's an open or closed complaint, save it. What will then happen is this complaint will then go in the history section at the top here. So you can then filter for all the complaints you have raised, whether it's open, closed, what the status is. It's all in one place. And again, it just saves you going through the manual folders. If CQC wants to see a certain complaint, you don't then have to go through the manual folder to find that complaint. You can just filter for it and then it'll be on your screen. If you were to kind of use any kind of manual documents that you have already in place, you can go into any of these folders, and let me just go into the staff and HR one, and you can right click on any folder and you can basically create your own templates if you want to, or upload your own documents, or even add your own subfolders, which you can do throughout the 16 folders. So it's just a case of basically right clicking on the folder where you'll get 3 options to create templates if you want to. So templates are mainly used for policies, so you can create your own policies if you want to. You can also upload documents. So it's just right click, upload documents if you've got your evidence that you just want to upload onto the system. So again, it's all in one central location and you haven't got bits of paper lying around. You can just upload the document into the folder. And then these are all the different kind of images or document types that you can upload. Or you can even just create a subfolder and then upload it into that particular folder that you basically create. But these 3 options will be available throughout the system, throughout these 16 digital folders. Maybe you want to kind of do like the water temperature check, which again is an online version for that log. So again, you just go into the relevant folder. Now, don't forget, you'll get a prompt in the calendar as and when you need to complete this task. and there will be a link within that prompt to navigate you to the actual log or the folder that you need to go into to complete that log. But you just go to the online version, record the information on there directly, and then again, once you save it, it will go in the history section. So again, you can see what's being logged. So these are the 16 digital folders. As I said, it's just a good way to have all of the information all in one place rather than having those manual folders. Another good thing that we also do is MHRA alerts. Now, all practices do need to be registered to receive the MHRA alerts from the government website, because they will send you all the healthcare alerts. But what our compliance team will do is if there's any kind of dental related alerts, they will filter those ones out for you and then pop them into this MHRA folder here for you. And the good thing is, let me just come out of there and I'll just get back into the folder. The good thing is what we've actually done is in this folder, we've popped it into subfolders for you already. So it's already in the alerts folder and we've separated it into subfolders. So you would just go into the 2024 folder or 2025 folder where, like I said, we've filtered out all the other alerts. You're only seeing the dental related ones in there. And then when you are going to read the alert, you just click on the alert, download it to read it, and then you just go into mark it as reviewed or not applicable. So it's having all of that information all in one place rather than going to different places to find the information that you need or want, because it will all be on here and the compliance team will do the hard work for us. They will get that information and pop it onto the system for you. It's just the case of obviously practices going in and making sure that you read the information and are aware of any kind of updates or alerts that you need to be made aware of and showing on the system that you are kind of going through it. So there's lots of other folders on here as well, but they do all kind of work the same way. Just going back on the dashboard, you've got the latest news section here, which everyone will have access to. So if there's any kind of platform changes, policy updates, MHRA alerts, it will all go in here so you get notifications as and when you need to be aware of certain things. And then a practice manager will also get access to our partner portal. So these are all the partners that we work with, and we're always adding new ones on here all the time. Rosie does that all the time. But these are all the partners. And say, for example, I don't know, you wanted someone to do DBS checks for you. I know Cavity does that. So if you hover over Cavity, it will tell you what they specialize in. And when you click into them, you'll find there's a number and email address on here for them. When you reach out to them, give them this code, they will offer you a discount. So we work with a lot of partners and who specialize in different areas, all of these different ones here, and they are basically here to kind of give you some discounts if there's certain things that you're looking for. Now, I know a lot of practices may be single practices, but obviously some might be groups. Okay. Before I go into that, obviously when you're already digital, the other thing is as well, it'll make it easier to share information quickly and safely with the CQC. So if obviously the information is already on here and they ask you for certain information, it's just a case of downloading it and email it across to them, or whatever way they ask you to send it across to them on the portal or digitally. So if you weren't digital, you'd then have to kind of scan it onto a computer or make a picture of it and then email it across to them. So going digital is definitely the way forward, because if it is already digital now, it'll make it easier for you when they introduce the portal where you have to send them things electronically. The group portal, as I mentioned earlier, a lot of practices may have more than one group, more than one practice in their group. So what we will then do is give them this option here, okay, where they don't need to basically go into each practice. This is basically, as I mentioned, for practices that have more than one practice in their group. It's a good way for the principal or compliance lead to get a bird's eye view of how each practice is performing without having to log into each practice portal. Okay, and this information then can be used during like a meeting to discuss any kind of positives or any kind of needs for improvement, and then you can obviously raise that with them directly when you go to visit them. So let's say, for example, you know, the online kind of complaints log that I showed you earlier in the compliance suite. If any of the practices in the group have raised any complaints, the principal or the compliance lead can come onto this page and they can see at a glance the total number of complaints that have been raised, who's getting the most complaints and who's got the fewest complaints out of the practices in the group, if they're still open, if they're closed. And what they can then do is drill down further by clicking on the tile to go down further by each practice. They can also change the tile here at the top or the drop down here at the top and look at the type or the complainee. So again, this is a good way for the practice to then see, or the principal to see, where they're getting the most complaints. If it's about treatment, for example, or the staff not answering the phone. Again, it's things that they can then pick up with the practice or the staff members and raise with them to kind of address those concerns. So it's really a good kind of tool to have, as I said, for a compliance lead or a practice manager or even, principal to kind of see what they need to kind of address, or even good things as well. Like if a practice is getting 100% in every single area, they know they've got nothing to worry about. They know that actually they are compliant with the the staff side of CPD courses, the recruitment information. If staff are reading policies, it's just a good way to get a glance of that. A practice manager or principal will also have access to the calendar on the system, which only they will have access to. So if there are any kind of issues that they may want to address with that particular practice, they can go in and create themselves a task, pick up this staff training with this particular practice, maybe put in some key kind of notes as to what they kind of want to address with them, save it, so they get a prompt when they go to the practice that they need to address those concerns with that practice. And then at a glance, they can also see all the staff within the group and which practices that staff member has access to, what training information that obviously we hold for them. Again, at a glance, if there's any gaps in anyone's training information. And again, these are things that can be picked up with the individual practices or the practice manager and kind of say, this is kind of something that we need to work on. And the same thing with the recruitment matrix as well. Again, to see if there's any kind of gaps in anyone's kind of personnel information. Maybe we're still waiting for somebody's contracts to be signed. We've not had that uploaded. So again, visually, you can see something's missing, go in and get that uploaded or get the practice to go in and do that. So hopefully I've kind of gone through, like an overview of the portal. That kind of concludes my side of it. I hope you found it beneficial. What I'm going to do now is I'm going to stop go back to the presentation. I'm going to pass you over to my colleague Helen, and then she'll continue with the CQC side of it.
Thanks, Veena. Just before you start, Helen, I just wanted to let you know that if you did want a further in-depth demonstration of the portal, or you wanted to ask any questions to Veena, then by all means, just reach out to us or pop a message in the chat and we'll be able to arrange that for you. Thanks, Helen.
So I've now got a relatively small presentation on common CQC inspection failures. So this isn't designed to tell you absolutely everything you need to have in place for a CQC inspection, but it covers the key things that either we found practices are missing or not getting quite right when we come out and do mock inspections, or what the CQC have noted in their reports where practices have failed a key question. So what we notice is that most failures fall under either the key question of safe or well-led. So it tends to be more about infection control, medicine storage, those kind of things under safe, or recruitment folders and training under well-led. So we'll start with staff files. So under the Health and Social Care Act 2008 and the rest of it, Schedule 3 lists the types of documents that need to be in everybody's staff recruitment files. And these ones are kind of the common bits that people have missing. So we need to have ID in place for everybody, and it does need to have a photographic element, so whether that be a passport or driving license. Right to work checks. So again, that's usually either your UK passport or some sort of validation card that you get from whichever country you're coming from. DBS checks at an appropriate level for the job role. I've got an extra slide on DBS checks coming shortly. References. So this is a big one. So if the previous role for an employee involved healthcare or working with vulnerable adults or children, you need to have 2 references in place. This is a really common one where people fail because either they haven't checked references or they've sent out a request and the previous employers have not come back to them. So we always recommend that you keep records of any attempts to gain references from previous employers, but also you can do a risk assessment. So if it's somebody that's relatively known to the practice, they're a local nurse that's come and you just can't get references from a previous employer, but you're happy with their conduct and their DBS and everything else, you can get a risk assessment signed for them just to say that you're happy. Otherwise, it might be that you then offer an extended probation period to outweigh the lack of references of previous conduct. Qualification checks. So again, this is quite a common one that people miss out. Everybody has their GDC certificate, but they don't always have proof of the qualifications that they have, but it is on the list of things that people check. A CV. So having a CV in place is really important, but most importantly, it's to check for any employment gaps. So employment gaps in themselves are not necessarily a bad thing. People may take time off to go traveling or to become a parent or other things, but they need to be written down and explained. If there are gaps, you don't know what's happened during that time, it can be cause for concern, especially for the CQC when they come out to check. Medical history. So this isn't to be nosy. This isn't to find out, all the gritty details about your staff, but it's to enable reasonable adjustments to be made. So, for example, if you know you've got a staff member who's diabetic, you can ensure that they've got access to food and water, and regular toilet breaks and things like that if they need it. Again, if you've got a lady who's going through the menopause, again, you can make sure that they've got access to a fan, water, restrooms, those kind of things, to be able to make reasonable adjustments as needed. Obviously, if you've got staff who have got allergies, it's a good one to have in place to make sure that you're aware, especially if they need to carry an EpiPen. And again, it's not there to be nosy, it's just to be able to help and support staff and also react in an emergency if you have a situation. And then lastly on this page, your immunisation history. So Hep B is obviously the big one for any clinical staff. So you need to have records of Hep B vaccination for your clinical team members, plus their titer levels. The titer levels are what are used to give your immunity status, basically. So it gives you that confidence that you've got full protection against Hep B, or if your levels are quite low and you're considered a non-responder, whether that means you need to go for additional courses or boosters, or you need to have a risk assessment in place to further protect that person who might not have the full protection that you need. But also general immunisation history. So our main ones that we look for, again, is Hep B, TB, HIV status if you're a clinician, but general things such as MMR, polio, diphtheria, those kind of childhood immunisations should be kept recorded on each of the staff records. So additional files that are checked, which don't fall under the Schedule 3, are your induction documentation. So CQC are really hot on making sure that everybody's had an induction when they start their employment. GDC certificates, the current ones for any registered team members. Indemnity, so again, really important for any registered team members. If you have nurses that work under the umbrella of a dentist in the practice, having a copy of their indemnity to show that the nurses are covered is really important. And having appraisals for your employed staff. So again, with appraisals, it's a way for the CQC for you to evidence to the CQC that you're having regular catch-ups with your team members. There's the option there for feedback, improvements, potential for career growth and all of those kind of things. And it's something that they look at all the time. So as I've written here, common failures are from a lack of DBS checks or risk assessments, references, immunisation history, inductions and appraisals. So DBS checks. You've got two different types of DBS checks, a basic or a standard one and an enhanced one. So clinical team members should all have an enhanced DBS check. One of the questions that gets asked a lot is, do non-clinical staff members need to have a DBS check? And the answer is generally yes, but there are situations where maybe not. So non-clinical staff, such as your receptionists or administrators, who have no contact with patients, so they're behind a screen in an office, they don't interact with any patients, so they have no contact with children or adults at risk, then they may not need to have a DBS check, but we would always recommend that they are done, or at least you have a risk assessment in place. If they are, however, in contact with patients, so they're on the front desk, but they are left with patients, so they may be left with children in the waiting room while mum and dad go into the dentist, or again, adults who have come with a carer and the carer's gone in and the adult is then left in the waiting room, we would always recommend having a DBS check in place, but a basic one for those situations would be sufficient. Repeating DBS checks, again, is always one that is a question we get asked a lot. From the CQC's perspective, there is no mandatory requirement to repeat a DBS check once it's been completed, but you should be doing regular risk assessments. And a risk assessment is basically just a declaration form that you get your staff members to sign to say that since their last check, their details haven't changed and they haven't got any convictions or anything that they want to declare to you. And as long as you've got those in place, that's usually enough. Staff training. So again, within CQC reports, they look and comment on CPD for the practices. So common ones where practices require improvement or don't meet a regulation are where they're lacking hands-on medical emergencies and basic life support training every year. ILS, so immediate life support for practices who provide sedation to patients. Learning disability and autism awareness. This is a relatively new course and it's only been mandatory since 2022, so lots still don't know that they need to have it in place. IRMA for your radiation practitioners, so this is your clinicians, hygienists, therapists and nurses who have the radiation qualification. Safeguarding to the required level, infection control, and then at the bottom there we've added sepsis and Legionella. So these courses technically aren't mandatory, but CQC check them all the time and ask for them. So it's always a good idea to have just a basic CPD course in sepsis awareness and Legionella awareness for your team members. So with safeguarding training, the intercollegiate guidance says that for non-clinical staff, so again, receptionists, admin team, things like that, they just need to do level 1 safeguarding. Clinical staff, so your nurses, hygienists, therapists, etc., all need to do level 2. And then technically, only paediatric dentists and specialists need to do level 3 safeguarding training. However, again, from feedback that we've noticed from CQC inspections is that they do like to see this is done for the registered managers. So again, we always recommend whoever is your registered manager or your safeguarding lead of the practice has completed level 3. If you have done level 2 as a clinical staff member, you don't also need to do level 1, providing your course content covers both aspects, which most do. So then moving on to risk assessments. Fire and Legionella risk assessments are always checked again by CQC when they come out to inspect. You have to have at least one carried out by an external specialist, because they are the ones that have the level of expertise and competence to be able to fully assess a practice. All actions and recommendations written in the reports must be signed off. So again, at the end of your risk assessment, you always have a box to say what you can improve on. And it might be simple things like adding a sign up against the wall or adding a sticker to say hot water, or they might be slightly more costly and bigger things such as adding fire doors or changing your pipe work from flexible hoses to copper piping, etc. But anything that they have recommended should be signed off and dated, or there should be an action plan sort of in progress. So if you've got things that you can't do immediately because of cost factors or just physically unable to get things done at that time, there should always be a living document to say that this isn't done yet, but we do plan to get it done on X date and why we can't do it. Within the practice, there should be a lead for fire, so your fire marshals or fire wardens, and one for Legionella. They should do CPD in these subjects, especially because they're the ones that need to have the required knowledge and competence to be able to fulfill their roles. Risk assessment frequency. So again, this is one we get asked at least once a day from practices. How often do I need to do my fire or Legionella risk assessment? The answer is there is no set frequency. Unfortunately, we can't give a straightforward answer. It depends on several factors. So with your fire risk assessments, or with both of them, it depends on your risk rating. So usually with your risk assessment, you'll be given a rating at the end to say that you're high, medium or low risk. Obviously, practices who have a high or medium risk rating will require more frequent reviews and repeats than those who are considered low or very low risk. Your previous action plans, again, as I say, if you've got a very simple action plan of you need to add a sticker here or there, then you're much less likely to need a more frequent review than somebody who's got a very extensive list where they basically need to renovate the entire building to make it safe. When you make changes to a building, so if you're adding an extension or adding a new surgery or making changes, so adding new dental chairs where the actual water lines are different, going from bottled water systems to pipe work or the other way around, that would also prompt a new risk assessment. And obviously, in the unfortunate circumstance of having a fire or a Legionella outbreak, if either of those occur, then you would need to make sure that you have a current risk assessment, but that would also prompt a new one to be done. So risk assessments should be reviewed annually by a competent person. This may be somebody in the practice, but being competent is somebody who has the relevant knowledge, skills, and experience. So if you're somebody who's been in the job for many years, you're well versed in checking and reviewing the fire risk assessment, you know what it is you're doing, you may be fine. If you're somebody new to the role, or you are not a manager, not a nurse, and a receptionist, you may not have those relevant skills in order to be able to review the risk assessment safely. And in those situations, it would always be recommended to continue using an external company to come in and do it for you. If you have any doubts as to, can I do this, get somebody else to come and do it with you. Audits. So Vina showed earlier on the compliance portal, the online version of the infection control audit, which needs to be done every 6 months. But there are some additional audits that the CQC like to check. So on their list of required audits is infection control every 6 months, radiography every 6 months, annual disability access, reasonable adjustments, DDA, however you want to phrase it, which needs to be done annually. And then they also have their recommended audits underneath, which I'm hoping they'll change the wording of that this year, because again, they check them at every inspection. They may as well add them to the mandatory list. So that includes your clinical record keeping audits, and they need to be done every 6 to 12 months. Antibiotic prescribing. So this isn't even on any mandatory lists yet, but CQC check it at every inspection. So we always recommend doing them. And hand hygiene. Again, not one that's currently on their list, but something that they check all the time. And it takes 5 minutes to do a hygiene audit once a year, just checking that everybody's washing their hands correctly. So with the clinical audits, nurses, practice managers, or anybody who is competent can help with the data collection for a clinical audit. So they can go through and check the notes, tick off the boxes to say whether things are captured within the clinical record keeping or the radiograph notes. But the clinicians then need to be involved. So you should be doing an individual audit per clinician. And then once the data has been collected, the clinician themselves need to go through this and check it. So whether that be they do it individually or as a peer review, as a group, they need to then go through and look at these findings to see where there are improvements that can be made. And again, if you have any improvements, you're not currently recording smoking cessation advice, or you're not currently writing down perio scores on a regular basis, then where you've found some improvements, there must be a planned date for completion. And again, that would be when you then review the next audit. Kosh, everybody loves Kosh. This is always the biggest folder. So again, moving to a digital platform is one of the best things with Kosh, because all of a sudden you go from a massive lever arch folder or multiple lever arch folders into having nothing at all. So with Kosh, all hazardous materials should be identified. So you need to have safety data sheets in place for all of your materials in practice. They can just be downloaded from Henry Schein or Wright Cottrell or wherever. The safety data sheets themselves will then indicate if that product is hazardous. So those little symbols you can see there on the screen, if they have any of those, or they have a rating above them that says like H3 or H306 or whatever it might be, then that indicates that that product has a hazardous property. And therefore you would then need to go on and do a Kosh assessment form for it, which then covers first aid measures, storage requirements, training, and all of those kind of bits. If the safety data sheet says this product has no hazardous properties, fab, that's all you need to do. Keep hold of the safety data sheet, scan it, or download it or upload it rather onto the portal. Job done, you can forget about it. One of the common things that people fall down on is your cleaning products. So it is recommended that COSH forms and COSH assessments are also completed for any cleaning materials in the practice. So toilet cleaners, floor cleaners, bleach, all of those kind of things. And again, then either kept separately with your cleaning cupboard if you have a separate cleaner that comes in who needs to be able to access the information, or stored on the portal so that everybody can gain access as and when they need to. Cleaning products and other COSH materials need to be stored appropriately. So again, something that the CQC always check is, where are you storing all of your stuff? Is it either in a locked cupboard or in a cupboard that is inaccessible to the public? So if you've got it upstairs around the corner in a room that's off the staff room that the patients and visitors cannot gain access to, brilliant. Or if it's on the main floor, making sure that it's in a locked cupboard so that it's inaccessible. And you've got some sort of signage available on the door to show that you've got COSH products stored in there. And they also like to check the storage of your mops and buckets. So making sure that you've got your colour-coded mops and buckets, your red, blue, green and yellow. The buckets are not stacked. They're all sort of stored next to each other, so they're not inside each other. And the mops are all wall hung with the mop heads facing upwards. And again, they're not just left in the buckets. Medical emergency kit. Again, I think actually this may be the biggest one that we find when we go out to practices or when we do virtual audits, that people just don't have quite right, or they have things missing. So common failures here include having regular aspirin. So it needs to be dispersible, the ones that's going to dissolve in the mouth, because if somebody's then having a heart attack, you need to be able to give them something that's going to work without them needing to be involved. Basically, they're not going to have to try and swallow some water. Again, midazolam. So practices sometimes will not have buccal midazolam, which is what is required for their kit. They may have ampules, and I have even known practices have rectal midazolam in their kits. Again, you need to be able to administer this to a patient who's having a fit very quickly and very easily in a sensitive manner. So buccal midazolam is what you need. Again, you can just squeeze it in the side of the cheek and let it do its job. Oxygen masks. So again, with oxygen masks, you have quite a gamut of kit that you need to have available. You need to have your self-inflating bags with masks, your high concentration masks, and then having the additional masks in sizes 0 to 4. And it's those ones that are usually missing for practices. So you've got nice little coloured ones there. You can see the blue, grey, white, yellow, orange and red. But they're always needed in place. And again, your airways in sizes 0 to 4. So again, practices will commonly have maybe size 2 and 3, which is sort of small adults available, but not the full range. And you need to make sure that you've got everything in place. The oxygen masks and airways are cheap as chips, and you can pick them up for sort of £2 each from your dental wholesales. So it's not a vast expense. In the surgeries, common things that we find that are not quite right again, or that are mentioned in CQC reports for practice surgeries, is that they are dirty or cluttered. So CQC like to see that they're nice and clean and clear, and they're just being used for what they need to be used for. Not having rectangular collimators in place, so they're what fit to the end of the X-ray arms, and they need to be in place for each piece of equipment. Storage of your local anaesthetics. So again, they are recommended to be stored in their blister packs until point of use. Again, we see it lots and lots where practices will pop them all out and store them in a box loose in the drawer. Problems with doing that is they're glass vials. They do have the potential to break when they're just jingling around in a box. But also it makes it a lot easier for them to go out of date and you not notice. If you're using them in a blister pack, you're popping out all 10 before you move on to the next one. If you're just putting them all in a box, it can be then that there'll be one or two left at the bottom each time, and you just add more and more on top. And burr storage. So we always recommend that burrs are either kept in autoclavable burr stands, so like the picture on the screen, which are then kept within those treatment trays. So you have separate ones for fillings, crowns, extractions, etc. Or if you have the odd individual burr that gets used once in a blue moon, you have those pouched and in drawers. So burrs shouldn't be just loose in drawers or in those large stands that you sometimes see on the side where dentists dip in and out all day, because then you're risking that cross infection. The decon room, again, making sure that surfaces are clean and uncluttered. Again, you see it time and time again where that you just chuck everything that you have spare in the decon room because it's somewhere to go. Making sure that all of your periodic testing is being completed. So you're checking and testing your autoclaves every day, recording your logs for your manual cleaning or your ultrasonic or your washer disinfector, depending on how you're cleaning your instruments. Having PPE available and making sure that it's used when you're doing your decon processes. So again, quite often we'll see that, decon rooms will be lovely, stocked well, you've got everything in there, but the nurse comes in to do the decon and she just puts a pair of gloves on. Not the heavy duty ones, no mask, no visor or anything like that, just a pair of simple gloves and off she goes. So making sure that it's available and used. For your heavy duty gloves, if you're doing manual cleaning, that you've got a log in place, and that can either be by writing the date of the glove was used in the cuff, or having an actual log, which we've got available on the portal to show that they're being changed on a weekly basis. Making sure that a suitable thermometer is available for your manual cleaning. So again, quite often it's like the probe thermometers that you have that are in the sink all times, and then with a little display that's stuck to the wall so you can clearly see the temperature of the water. And you have a magnifying light available, and it is on and working, because again, we often see them there be unplugged in the corner of the room, covered in dust. They haven't been used for 10 years. So making sure that they're there and available so that you can be inspecting your instruments as you go from the cleaning to the sterilisation process. Equipment and maintenance. So you need to make sure that you've got all of your service records available. And again, common ones that people miss or don't have available are for your autoclaves, compressors, gas appliances is a big one. Lots of people forget about those. So making sure that if you've got a gas boiler in place, it is serviced annually. Your X-ray equipment. So for here, it's both your critical exam acceptance test, which you have done when the equipment is first installed, and then additionally, any routine testing and servicing that you have done afterwards, whether that be annually or every 3 years. Air conditioning, fire and smoke alarms, again, making sure that the fire and smoke alarms are tested every 6 months, if applicable, rather than every year. Your fire extinguishers, and then your emergency lighting. And then signage. So CQC often mention on reports that signage isn't available. The most common one is that yellow compressed gas sign. So this needs to be available at the front or the entrance of the building, so that if there was a fire, especially out of hours, the fire brigade can be alerted to know that there is compressed gas, which is your oxygen cylinders, inside the building, and they've got that fair warning ahead. But also labelling where your emergency drugs, oxygen, defibrillator are all kept and stored. Your fire action notices periodically around the building to alert people of where the assembly points are if they need to evacuate. And again, your fire exit signs clearly en route and above any fire exit doors.
Wow.
That's the end of that one. Thank you very much.
Thank you so much, Helen. I mean, that was fantastic tips and advice there as to how to remain compliant and pass those inspections. Like Helen said, just a snapshot of the many things that the compliance team and our portal cover. As you can see, I mean, I'm not in dental, in the dental kind of practice myself, but there is so much to consider, so much to think of. So no wonder compliance can seem overwhelming and maybe daunting to a lot of practices. Thank you so much, Helen. I really appreciate your input on that. That was fantastic. I think you'll all agree with me that to have something in place like a digital system to simplify so much of this is really critical. And if it's something that you would like to discuss in a bit more detail, or you'd like to see how it could work in your practice, then you can just get in touch with us. After this session, we'll pass on our contact details. We'll send over this information over to you as well. Any questions that you have, we'd be more than happy to help. Thank you. So I think, Vina, if we just go on to the next slide, I think we're going to go through the questions. I know we have answered a few questions. Helen's kindly answered a few in the chat as well. So there was a question with regards to the CPD training, of which Helen's answered there. The frequency of those is every 3 or 5 years. Is that right, Helen?
It
Completed
varies
annually.
Yeah, it varies from subject to subject. Things like medical emergencies have to be done every 12 months. Others, such as safeguarding, is every 3 years. And then you get to the sort of less critical ones that need to be done for your GDC registration, such as oral cancer screening, legal and ethics. They can be done sort of once every 5 years.
Brilliant, thank you. And then there was another question around the kind of group. So if you have more than one practice, can you see everything from the portal? I think Vina did explain that we would be able, you would be able to kind of have a group reporting feature, which would give everybody, you know, the kind of overview, or the manager, the overview of how everybody's performing. Do we have any other questions that we could answer? Pick Helen's brain or Vina's brain.
Yeah, well, you've got me.
Do you want anything?
Right. I think oh no, Katie is typing. Brilliant. Okay, so Kaylee is happy with what you've mentioned, and honestly, I feel this, you know, whole CQC process is quite exhaustive and extensive. No wonder it's a cause for stress for the practices. So well done. It's a great platform that you've got, and it seems to cover a lot of the areas, but basically all of the areas that you would be inspected on. So yeah, going digital does make it seem quite neat, makes it all neater and more efficient, isn't it? From a non-dental background, I could see that. So yeah, I appreciate that.
Yeah.
So brilliant there.
Thank you, Vina. If you could just go to the next slide, it's just got our some contact details on there. Should you need them, just our email address is there at the bottom. And as I say, please feel free to contact us.
That's lovely. I'll take these details as well, and I'll send out the presentation to our attendees. Thank you very much for that. I would like some feedback, please. If I can just pop the feedback form into the chat. So it would be, I would appreciate if you could just give your feedback on the session, and it'll help us arrange and plan other sessions for yourselves. I will also, as promised, add the other events that we are running under the Innovation Navigator program. And if you would like to get in touch, please do get in touch for the one-to-one consultations and all the free business support that we are offering under our program. So I'm putting the links in for that as well.
Thank you.
Right. Thank you very much for today. It was great having you on board, and look forward to collaborating with you again.
Thank you very much for having us.
Thank you.
Thank you.
To everybody, bye-bye.
Bye.
Thank you very much. Bye-bye. Bye-bye.